Can you tell me a little bit about the pain, sort of what qualities it has, what it feels like?
It's more this knee, and it's almost like the kneecap's kind of out of place, and it's more when I'm running downhill.
Okay.
It's not so bad on the flat or uphill, it's running downhill.
Right, so it's more the impact when you come down, yeah. And will you notice it after the run?
Not always, sometimes during.
Okay.
Yeah.
And will it stop you running, or do you feel like you have to take a break?
No, I tend to ignore it.
You just push through it?
Yeah. Sometimes I'll stop and wiggle my kneecap and then carry on.
Okay, all right. But despite that helps at the time, it still feels like it's been getting worse and it's a bit more. Yeah. Have you seen anyone else about this?
No.
Okay. All right. Lovely. Thank you very much. So I'd agree. Different styles there, absolutely. So in terms of body language, there was some quite obvious differences there. Susie was a bit more hands in her lap, wasn't that gesturing outside. So that's something I was picking up on quite quick, as I'd start to, keep my hands in my lap a bit more. Whereas with John, I was more gesturing, hands coming around, that sort of thing. Tone of voice, the speed, the things that we were talking about as well. It was a little bit more factual. It was a bit more, this is the problem, this is what's been going on. So that led me to change my questions. I was asking more kind of closed questions, more yes, no, tell me about this factor, that factor. With John, I'd be a little bit more open-ended with things. So it's not just about the behavior, the body language, the way I'm talking. It's even the questions you might ask, the way you might frame things. We'd start to change things around as well there.
Okay. When you run your courses, is this the sort of thing you do? Do you get role-playing like this too? Not that this is technically role-playing. Are you putting people through the mill and saying...
Yeah, absolutely. It's nice if somebody has a problem they can talk about, but I always say don't make up a problem. Because if it was practitioners in a room, we were all practicing, if they're in their head thinking about, oh, what should I say? They're going to get stilted anyway, and it gets harder to read. So I usually will put up examples to say, and on the break I'll say, look, just have a think about, a time that you went on a really lovely holiday, or a good one is, a problem that you're facing, you have to make a decision, but you haven't thought about it yet. So it can be about things completely different. We're doing this in the context of knees and backs and that sort of thing. But you can use social styles. The thing I love about communication is it's not a clinical skill. It's just a human to human skill. And with the feedback I often get from people that have done the courses are, this has helped, improve their relationship with friends, or I know it's improved my marriage, being able to better understand and connect with my wife. I had one chap, in fact...
Has she done your course as well?
No, she's trained as a counsellor, actually. So she has a lot of similar approaches to communication things.